Obviously, the New York State coronavirus death toll in nursing homes is absolutely horrific. We all know that. The Democrats can try to deny it. They can praise Governor Andrew Cuomo of the state of New York for handling it well, when really Governor Cuomo is responsible for the spread of COVID-19 in nursing homes because his health department issued a mandate that forced nursing homes to readmit patients who had tested positive for COVID-19, even though the rest of the population was highly vulnerable to fatality. But there's a new theory or new data that shows that even as horrific as the death toll in nursing homes in New York is right now, it might actually be worse. It might be undercounting because the current death toll is only counting people who have died on the premises. It doesn't count nursing home residents who contracted the virus, went to the hospital, and died in the hospital.
Right, and the Cuomo policy is even worse than you just described because they actually prohibited nursing homes from testing patients who were being admitted or readmitted from hospitals. And so they weren't even able to determine whether a patient coming from a hospital had COVID or not. We know that New York admits to about 6,600 nursing home COVID deaths. But that is definitely a massive undercount because of what you pointed out. They've got an asterisk on that number that says this only includes deaths inside the facility. Well, most of the time when a nursing home resident gets severely ill, they call 911, they move them to a hospital. It's very rare, actually, to die on the premises. That typically only happens if there's a do not resuscitate order and they just let them die because that's what the person wanted. Or if it happens overnight when there was no one there to notice it, and then they come back in the morning, they find someone in the bed, those sorts of situations. But more often than not, if somebody is in bad shape, is in critical condition, they will call 911, they'll move them to the hospital, and if they don't recover, they'll die in the hospital. None of those hospital deaths of nursing home residents are in the count from New York as they publish it, even though every other state publishes the number of long-term care residents who died without respect to where they died. And so New York is obviously hiding the real number. The question is, and I think a lot of us have assumed that the real number was something like 10 or 12,000, but they've been so adamant about hiding it and not giving that number that it makes you wonder if maybe it's 15 or 20,000, some number that's just so mind-bogglingly high that they'd rather take the political hit of having the cover-up rather than let us know what the real number is.
Well, and they're certainly engaging in a cover-up. I mean, Janice Dean, a meteorologist for Fox News, both of her in-laws, her mother-in-law and her father-in-law, died of COVID-19 based on Governor Cuomo's nursing home policy. They died in New York nursing homes from the coronavirus. She was initially invited to testify about this, and then her testimony has been blocked. They have disinvited her. They won't allow her to testify now because they are engaging in this cover-up, and they cannot allow the truth to be heard, because when it does, it reflects extremely poorly on Governor Andrew Cuomo. I mean, it might be the biggest political scandal of 2020, the way that Governor Cuomo mishandled COVID-19 and then refuses to take responsibility for it. And they don't want people to know the truth because the mainstream media and Democrats alike have spent the past months praising Governor Cuomo.